there are so many questions that you probably have in your pregnancy. One of them might be, how should you breathe when you're pushing your baby out? Or maybe you haven't even thought that far yet and I'm totally overwhelming you by bringing this up. But I'm treating you like my mom, my sister, my best friend, and I want you to know all the inside scoops so that your birth experience is even better. My name is Carrie Koziel, and I'm a women's health specialist and also a prenatal Pilates specialist. And I've designed a 6-week class, a prenatal Pilates class, that's a combination of education and exercise, so I can teach you some of these very things. So I've just spun my pregnancy wheel of wisdom, and it landed on birth breathing. How should we breathe during birth? So let's talk about the 2 different ways of breathing. The first way of breathing is with a forced inhalation, and what that looks like is a deep breath in, you hold your breath, and then you bear down hard in your bottom like you're having a bowel movement. We talked in a previous video how this isn't the greatest way to picture and visualize your baby coming out, but when you hold your breath like that, a couple of things happen. Number one, your diaphragm becomes the driver of the push way up here. We really don't want the diaphragm driving the push. We'd rather have the muscles closest to the uterus driving the push because that push is more accurate. It's closer to the vaginal opening. Think about it like painting your nails. Would you be more accurate painting your nails with a tiny little brush that's right onto your fingernail? Yes. Versus a really big brush up here that's trying to direct where you're moving. Obviously, the closer we can get to the source, the better it is. So a better way to breathe during a vaginal delivery when you're pushing is breathing with an exhalation. And what that looks like is taking a deep breath in through your nose, drawing the breath to the back of your throat, and then giving your breath to your baby as you send that breath all the way down behind your baby, almost in a J shape towards your pubic bone. So again, with me, try that. Deep breath in through your nose. Draw the breath to the back of the throat. Send your breath down, all the way down behind the baby and around towards your pubic bone. You can even make a little bit of a sound when you do that during birth. And breathe your baby out with an exhalation. When you do that, you take your diaphragm totally out of the equation so that the muscles that are closest to the vaginal opening are what's pushing the baby out, making the push a little more accurate and a little safer for you and the baby. That is a better way to push and to breathe when you're pushing, and I hope you learned a little something in this video. This is what I'm hoping to do in my 6-week prenatal Pilates classes, give you little nuggets of information in easy to understand ways, because pregnancy is overwhelming enough, but I think the things I teach you will totally change your birth experience. Plus the exercises you learn are expertly designed and you're gonna love them. Log on to carriekoziel.com to learn more.